If you're over 70, there's a quiet question many people carry but rarely say out loud. Am I really as healthy as I think I am? You may feel fine. You may still walk, cook, laugh, and live independently. But here's something doctors don't often explain clearly enough. After 70, the body can change silently, without pain, without warning, and without obvious symptoms. Some of the most serious health problems don't announce themselves until they've already done damage. And that's why today's video matters. Because there are 5 health checkups that can quietly protect your independence, your memory, and your quality of life. Yet most seniors are never told to ask for them. And number 3 on this list? It surprises almost everyone who hears it for the first time. After 70, medical care often becomes reactive instead of preventive. You go to the doctor when something hurts, when dizziness appears, when blood pressure spikes, or when sugar levels are off. Those things matter, of course, but aging doesn't always work that way. The body becomes quieter, signals become softer, problems can grow in the background while routine tests still look normal. That's why these checkups exist, to catch the silent shifts before they turn into life-changing events. Let's start with the first one, because it protects something nearly every senior fears losing: independence. Falls are not just accidents, they are often warning signs. After 70, a fall is rarely just a slip. It's usually the result of subtle balance changes, slower reflexes, weaker stabilizing muscles, or small nerve signals not firing the way they used to. The problem is, most seniors are never offered a proper balance and gait assessment unless they've already fallen. And by then, confidence is often shaken. A balance and gait checkup isn't just watching you walk down a hallway. A proper assessment looks at how your feet lift, how your body adjusts to small changes, how your inner ear responds, how your eyes and brain coordinate movement, and how quickly your muscles react when you're slightly off balance. Research shows that small declines in balance can start years before the first serious fall. Catching those changes early allows for simple interventions, specific exercises, physical therapy, footwear adjustments, or vision corrections that can dramatically reduce fall risk. And here is something many people don't realize: fear of falling itself can make balance worse. Seniors who subconsciously stiffen their movements because they're afraid actually become less stable. A balance assessment can restore confidence by showing exactly where the issue is and what can be done to strengthen it. Now let's move to the second checkup, and this one protects something deeply personal: your thinking, your memory, and your sense of self. Most people believe memory tests are only for diagnosing dementia. That belief alone keeps millions of seniors from ever getting screened. But cognitive checkups after 70 are not about labels. They're about baselines. Your brain changes with age. This is normal. Slower recall, occasional word-finding trouble, forgetting names briefly. But there's a difference between normal aging and early cognitive decline, and the line between them can be very subtle at first. A simple cognitive screening creates a snapshot of how your brain is functioning right now. Attention, processing speed, short-term memory, problem-solving. Nothing invasive, nothing frightening. Why does this matter so much? Because early cognitive changes can sometimes be slowed or even partially reversed when caught early. Causes like vitamin deficiencies, sleep apnea, medication interactions, dehydration, depression, or untreated hearing loss can all affect memory. Without a screening, these issues are often mistaken for just getting older. And here's the part doctors rarely explain. Once cognitive decline becomes obvious to family members, it's often already advanced. A quiet baseline test at 70 or 72 gives doctors something powerful, a comparison point years later. It helps separate normal aging from something that needs attention. So far, we've talked about protecting your physical stability and your mental clarity. But now we come to the third checkup, the one that surprises most seniors, and honestly, many doctors too. This one has nothing to do with pain, nothing to do with energy, and nothing to do with how young you feel. It's a muscle mass and strength assessment. Most people associate muscle loss with frailty or being bedridden, but muscle loss, called sarcopenia, can begin quietly in your 60s and accelerate after 70. Even in people who walk every day, you can look the same, weigh the same, even stay active. yet still lose strength where it matters most: hips, thighs, core, and grip. Why does this matter? Because muscle is not just for movement. Muscle helps regulate blood sugar, protects joints, supports balance, and even plays a role in immune function. Studies show that low muscle strength after 70 is strongly linked to higher risk of falls, hospitalizations, slower recovery from illness, and loss of independence. What makes this shocking for many seniors is that walking alone is often not enough to preserve muscle. Walking is excellent for the heart, but it does not challenge muscle strength enough to stop age-related loss. A muscle assessment can be as simple as grip strength, chair rise tests, or resistance measurements. If weakness is found early, gentle strength training, even just twice a week, can make dramatic improvements at any age. And this is where many people feel a sense of relief. Muscle loss is not a one-way street. Even in the 70s and 80s, muscle responds to training. The body wants to stay strong, it just needs the right signal. Now, there are still 2 more checkups every senior over 70 should know about. One that protects vision in a way most eye exams miss, and another that quietly affects energy, heart health, and longevity without obvious symptoms. We'll get to those next. Just remember this: aging doesn't steal health overnight, it does it quietly. And the seniors who stay independent the longest aren't just lucky, they're informed. We'll get to those next. The 4th checkup protects something many people assume is already being covered, but in reality, it often isn't. Most seniors get their eyes checked for glasses, maybe for cataracts, sometimes for glaucoma. But there is a critical piece of vision health that is rarely discussed after 70, and that is contrast, sensitivity, and depth perception. Here's why this matters. You can read clearly. You can pass a standard eye chart, and yet still struggle to see steps, curbs, uneven ground, or objects in low light. That weighs because contrast sensitivity, the ability to detect edges and subtle differences between light and dark, declines with age, often without the person realizing it. Depth perception can also quietly weaken, especially when both eyes don't work together as well as they once did. This is one of the hidden reasons falls happen in familiar places, like the home. Stairs that were never a problem before suddenly feel tricky. Parking lots feel uncomfortable at dusk. Night driving becomes stressful. These changes don't always show up in routine exams, unless they're specifically tested. A contrast and depth assessment can reveal issues early, and the solutions are often surprisingly simple. Better lighting, specific lens adjustments, targeted eye exercises, or treating early eye conditions before they affect daily life. When vision works properly with balance and movement, the body feels more confident. When it doesn't, the brain hesitates, and hesitation increases risk. Now let's move to the 5th and final checkup. And this one is often completely overlooked unless something goes very wrong. It's a comprehensive medication review. After 70, many people are taking multiple prescriptions: blood pressure pills, cholesterol medications, diabetes drugs, sleep aids, pain relievers, stomach acid reducers, maybe something for anxiety or mood. Each one may be appropriate on its own. But together, they can quietly interact in ways that affect balance, memory, energy, and even heart rhythm. What makes this especially important is that older bodies process medications differently. The liver and kidneys slow down. Drugs stay in the system longer. Side effects become stronger. And sometimes, a symptom blamed on aging is actually a medication issue: dizziness, brain fog, fatigue, dry mouth, constipation, or sudden confusion. A proper medication review looks at every prescription, every supplement, and even over-the-counter products. It asks important questions. Is this still necessary? Is the dose still right for this age? Are 2 drugs doing the same job? Are there interactions that increase fall or memory risk? Studies show that medication adjustments alone can significantly reduce hospital visits in seniors. And yet, many people go years without anyone looking at the full picture. Now, if you step back and look at these 5 checkups together: balance and gait, cognitive screening, muscle strength, advanced vision testing, and medication review, you'll notice something important. None of them are about disease. They're about function, about how well your body and brain work together to support your daily life. This is where aging care often misses the mark. It focuses on numbers: blood pressure, cholesterol, sugar levels, while overlooking the systems that actually determine whether someone stays independent. The good news is that it's never too late to ask for these assessments. And asking does not mean something is wrong. It means you're being proactive. It means you're choosing to stay ahead instead of reacting later. Many seniors worry that asking for more tests will lead to bad news. But in reality, early information gives you options. It gives you control. Small changes made early, strength training, vision adjustments, medication tweaks, cognitive support, can add years of confidence and capability to daily life. And here's something deeply encouraging. Research continues to show that the body and brain remain adaptable well into the later decades. Balance can improve, muscle can grow, memory can stabilize, vision function can be optimized. None of this requires extreme effort. It requires awareness. Most people don't decline because they age. They decline because small issues stack up unnoticed. These 5 checkups help stop that stacking effect before it steals something precious. We're almost done. And there is one final perspective that ties everything together, why doctors often don't talk about these checkups unless you bring them up, and how to have that conversation without fear or pressure. And here's the part many seniors find both surprising and empowering. Most doctors are not ignoring these checkups because they don't care. They're often focused on urgent problems, tight appointment times, and immediate symptoms. Medical training traditionally centers on diagnosing disease, not always on preserving daily function as we age. So unless a patient complains about falling, memory loss, weakness, or confusion, these quieter issues may never come up in conversation. That's why the most important step after 70 is learning how to speak up in a simple, confident way. You don't need to demand tests. You don't need to sound worried. You can simply say things like, "I want to stay independent as long as possible. Are there any function-based checkups I should do at my age?" That single sentence can open the door to balance assessments, strength testing, cognitive screening, and medication reviews. Another powerful approach is to connect these checkups to everyday life. If you've noticed feeling less steady on stairs, more tired than usual, or less confident driving at night, those are valid reasons for evaluation. Even subtle changes matter. In fact, subtle changes are exactly what these assessments are designed to catch. It is also important to understand that prevention after 70 looks different than it did at 40 or 50. It is not about chasing perfect lab numbers. It's about maintaining resilience, the ability to recover quickly, stay mobile, think clearly, and adapt when life throws something unexpected your way. One of the biggest myths of aging is that decline is inevitable and irreversible. In reality, much of what we call aging is actually deconditioning. Muscles weaken because they aren't challenged. Balance worsens because it isn't trained. Memory slips because underlying issues go untreated. When these things are addressed, improvement often follows, even later in life. There's also a psychological side to this that deserves attention. When seniors feel informed and proactive, fear decreases. Confidence increases. And confidence itself improves movement, decision-making, and overall health. The mind and body are deeply connected, especially as we age. Family members often notice changes before seniors do, but that doesn't mean independence is already lost. These checkups create a shared understanding. They help families support, not control. They allow planning without panic. If you're watching this and thinking, "I feel fine, so maybe I don't need all this," that's actually the best time to consider it. Feeling fine is when prevention works best. Waiting until something goes wrong limits options. And if you're thinking, "I've already slowed down so it's too late," that's simply not true. Strength responds, balance responds, the brain responds. The body wants to stay capable. Aging well is not about avoiding birthdays. It's about protecting the systems that let you live on your own terms. These 5 checkups aren't about finding problems. They're about protecting freedom.